So today we will talk about the gynae history, that how you will take history from a gynae patient. So the common steps involved in the history taking are biodata, cheap complaints, history of presenting illness, past obstetrical history, menstrual history, systemic history, past medical history, past surgical history, past drug history, allergy history, vaccination status, family history, socio-economic history, and the personal history. So the first step in the history taking is biodata. In biodata, ask about the name of the patient, age of the patient, ask about the husband name, occupation of the patient and the husband occupation. Also ask about the marital status, whether she is married or unmarried. If married, then ask about the time of the marriage. Also ask about the address of the patient. Also ask about the date of admission and the time of admission, and similarly also ask about the mode of admission, whether she is admitted to OPD or emergency. Similarly ask about the LMP. LMP stand for the last menstrual period, which is the first day of the last menstrual period. Also ask about the gravida and the para. Gravida means the total number of time the uterus get pregnant, including the current pregnancy, whereas para means the number of live births or stillbirth after the period of viability, and the period of viability is 24 weeks. Let's suppose if a female is pregnant for the fourth time and she has three live children, so her gravida is 4 because she is pregnant for the fourth time, but she has three live children, so her parity is 3. So she is Rapo para 3. So the next step in history taking is chief complaints. So chief complaints are the symptoms due to which the patient present to the hospital, and write them in the patient own words and mention the time duration of each symptom, and write the chief complaints and chronological order, which means write them from the older one to the new ones. Like patient having abdominal pain from 5 days and for vaginal bleed from 2 days and a fever from 1 day. Then next one is the history of presenting illness, and HOPI explain all the chief complaints in detail in paragraph form. Like a patient and start it as a patient was well till dead, but from the last 3 or 4 days she had a complaint of, let's suppose, abdominal pain from the last 5 days, and then explain that complaint in detail, like ask about the site of the pain, onset of the pain, duration, progression, associated factors, aggravating factors, and relieving factors. And if a patient had any chronic disease like diabetes or hypertension, then start the HOPI as a well-known diabetic or hypertensive patient from past 3-4 years, but now presented with a chief complaint of, let's suppose, abdominal pain from 4 or 5 days. Now let's talk about some common complaints in the gynae. The first one is the abdominal or pelvic pain. So in pain history, ask about the site of the pain, onset of the pain, whether it is sudden in onset or gradual in onset. Also ask about the duration of pain, course of pain, whether the pain is continuous or episodic, and also ask about the severity of pain, whether it is mild, moderate, or severe in intensity. Also ask about whether the pain radiates to any area or not. Also ask about the aggravating factors, relieving factors like any medication that relieves the pain, and similarly also ask about the associating factors like fever or vomiting associated with the pain or not. The second one is the vaginal bleeding history. So in PV bleed history, ask about the onset, whether it is sudden or gradual in onset. Ask about the duration of the PV bleed. Also ask about the course, whether it is progressive or fluctuant. Also ask about the color, whether the blood is bright red or brownish in color, whether the clots are present or not. And also ask about any association of the PV bleed with the menstrual cycle, and ask about the severity, whether the bleed is heavy or not, and also ask about the aggravating factors, any relieving factors. Also ask about the associated symptoms with the PV bleed, like any history of pain or fever. Also ask about any history of bleeding disorder, and similarly also ask about any chronic disease. Then the next common complaint is fever history and associated urinary symptoms in case of pelvic inflammatory disease or UTI. So in fever history, ask about the onset, duration pattern, whether PO is continuous or intermittent. Similarly, also ask about the severity, also ask about aggravating factors and relieving factors and any associated symptoms like history of sweating, rages, and chills with the fever. And urinary symptoms ask about history of burning, maturation, urinary frequency, urgency, hesitancy, and dribbling up urine. Similarly, also ask about the symptoms of urinary obstruction. Similarly, ask about any prior history of visit to a doctor for such complaint, and also ask about any prior investigations done and its record found, and similarly also ask about any drugs prescribed. Next one is the menstrual history. So in menstrual history, ask about the age of menarche. Menarche is the first menstrual cycle. Similarly, ask about the LMP, which is the first day of the last menstrual period. Similarly, ask about the average duration of each menstrual cycle plus number of bleeding days. Like let's suppose a patient having a 5 bleeding days with an average cycle of 28 days, and also ask about whether the cycle is regular or irregular, and also ask about the flow, whether the flow is normal or heavy. Similarly, ask about any clots present in the menstrual blood, and similarly also ask about the number of pads she changes per day. Also ask about any history of dysmenorrhea, which is a painful bleeding, and similarly also ask about any history of discharge, which indicate pelvic inflammatory disease. Similarly, also ask about a history of any history of intermenstrual bleed and any history of contraceptive she had used. So the next one is the past obstetrical history. So in obstetrical history, ask about the parity. Parity means the number of live births or stillbirth after the period of viability, and the period of viability is 24 weeks. Similarly, also ask about the number of male child and female child, and also ask about the age of each child, and similarly also ask about the period of gestation, whether all the children are born full term or there is any history of preterm pregnancy, and similarly also ask about the mode of delivery, and also ask about the place after delivery, whether it was home delivery or hospital delivery, and similarly also ask about any complication during pregnancy, during delivery, after delivery, and similarly also ask about whether the child is breastfed or not, or the cry was immediate or delay, and also ask about the vaccination status of the child, and similarly also ask about the current status, whether all the child are alive or dead. So next one is the systemic history. In systemic history, the first one is CNS history. And CNS history asks about any history of headache, dizziness, weakness, abnormal movements, loss of consciousness, pets history, and any change in the behavior. And GAT history asks about the history of dysphagia, jaundice, heartburn, vomiting, hematemesis, diarrhea, any history of constipation or abdominal pain or melena. And cardiopulmonary history asks about the history of cough, dyspnea, hemoptysis, chest pain, palpitation, syncope, and cyanosis. And urogenital history asks about any history of dysuria, vaginal discharge, ask about urinary frequency, urgency, hesitancy, burning maturation, any history of hematuria or per vaginal bleed, and skin and musculoskeletal system history ask about history of skin rash, any history of ulcer, pigmentation in the skin, body aches, and muscle pain or joints pain. Next one is the hospital course. So in hospital course, ask about any investigation done, any medication prescribed, any intervention done, or any improvement seen in the symptoms. In family history, ask about any history of chronic disease running in the family, like history of diabetes, mellitus, or hypertension. And similarly, also ask about the consanguinity marriages, family history of any cancer like breast cancer, endometrial, or ovarian cancer, and the first degree relatives. And past medical history ask about any prior history of any disease, and the past surgical history ask about any history of surgery done in the past. Next one is the immunization history. So immunization history asks about the vaccination status of the patient. And next is the drugs and the allergic history. And drug history asks about the history of long-term or short-term medication she is taking, and also ask about the dosage of this medication, and similarly also ask about any history of allergy to medication. And socioeconomic history ask about the patient occupation, living conditions, number of earners, number of family members, own house or rented house, and also ask about the water supply. In personal history, ask about any history of addiction, ask about bowel habits, and similarly also ask about sleep patterns, and also ask about any social problem. At the end, say thanks to the patient. So it was all about the gynae history.